Hello, hello, hello again. It's your personal dental insider here, and today we're focusing on this tooth that has this significant decay, or this large decay, or this badly decayed mandibular first molar. Mandibular mean, of course, it's because it's the lower jaw. First molar because it's right beside that little tall tooth. It's one of the first big grinding teeth that you have in the mouth. So it's called the first. Mandibular because of the jawbone, the lower jawbone, and molar because that's what it is, or one of your grinding teeth. So here this radiograph is showing a large periapical. We talked about what periapicals are. That's the x-ray or the PA, abscess at the tip, and that's this area right here. You see that dark shadow right around the root of that tooth? See? That dark shadow right there off the tip of the mesial. Mesial because when you look at this tooth in the radiograph that I showed in a previous video, when I told you the smile line, you'll see where the smile ends at the jawbone and where it goes to the front. So anything that's into the front of the tooth is called mesial. There's also a previous video that showed you about the different surfaces of the tooth. So that's where you got that mesial root. That's this guy right here. Badly decayed because if you notice all this shadow, there's no white showing the wholeness of this tooth. So this whole area is eaten out. Okay, and we talked about periodontal diseases, the types, but I wanted to show you just that. And how did we get there? How did this tooth become like this? Here it is. And it tells you how dental decay occurs. In order for dental decay to occur, 3 factors must be present. 1, dental plaque, which contains bacteria. Remember, we talked about bacteria in the mouth. It's the place that has the most bacteria. 2, the nutrients that the bacteria are able to use to generate an acid attack. 3, a susceptible tooth. So here is this poor little tooth being the one that is getting attacked. I'll go back to that picture of that tooth. So this is the one that actually got attacked. See? Possibly maybe because during the brushing technique or portion, this tooth hadn't gotten that much cleaning. There was no flossing taking place. So over time, that attack just kept on coming at that tooth, making it more vulnerable and weaker. Okay? Again, I am looking for your comments, questions, or concerns. And of course, when was the last time that you were at the dentist? What was the most thing that you heard that got you confused? And because of that, you left without making a decision on having treatment done. And of course, anything else that comes to your mind in regards to your last visit. If you haven't had a visit recently, then what's hindering you? What's causing you not to go to the dentist? What's going on? I want to hear from you. Again, drop me a line, send me an email, leave a comment, and I'll be more than happy to answer any questions or concern that you have to the best of my ability. Until I hear from you,